Hey guys, welcome to Oral Surgery Exclusive. Thank you for becoming a member and congratulations on taking this step towards a commitment to learn. This is Dr. Ketki and today we're going to learn the different surgical techniques for the management of jaw cysts. A cyst is basically a pathological cavity usually lined by epithelium and filled with fluid or semi-fluid material. In this video, we are not going to discuss individual cysts, but we are going to learn the basic principles of surgical techniques which can be applied for the management of any kind of cyst. So there are four basic methods to treat the cyst of the jaw. Enucleation, which means getting the cyst out completely. Marsupialization. In Latin, the word marsupial means creating a pouch. So marsupialization means we are converting the cyst into a pouch. The third method is the combination of the two, and fourth is enucleation with curettage. Let's learn each one in depth now. Enucleation is also called as Pash 2 operation or cystectomy. It was first described by Pash in 1910 and it basically means removing the entire cystic lesion. Getting it out in one piece should be the goal. So how does a cyst actually come out in one piece? You see, a cyst has a layer of fibrous connective tissue between the epithelial lining of the cyst and the bony cavity. So this layer gives us a guide path. If we go along this layer, we can remove the entire cyst in one piece. It's good to get it out in one piece because if the cyst wall gets ruptured, there is a high chance that some of the cells will be left behind and these cells will again proliferate or grow and make a new cyst. So that's why when we remove it in one piece, we can be sure that we have not left behind any part of the cyst. Enucleation can be done for removal of all of the cysts of the jaw that can be safely removed without sacrificing adjacent structures. Let's see how it's done. So here we need to reflect a trapezoidal flap. For this, the horizontal incision is made first. We are using the Bard Parker number 15 blade. While planning the incision, you should also make sure that the incision will be away from any kind of bone defect that will be created after removal of the cyst. This is one of the basic principles of surgery, that the incision line should always be supported by healthy bone. Otherwise, it will affect the wound healing as it will cause wound dehiscence. When the surgical incision reopens and exposes the wound, it's called as wound dehiscence. The next important thing is that the incision should be long enough so that we don't have to excessively retract the flap in order to gain access to the cyst wall. After making the incision, the next step is obviously flap reflection. This is done with a periosteal elevator. Sometimes the cyst is so big that it causes perforation of the buccal cortical plate and it fuses with the soft tissues. In this case, it becomes a little more difficult to separate the cyst from the normal tissue, right? This is when we need scissors that will help in dissections. So we mostly use Dean scissors or curved Metzenbaum scissors. The Dean scissors have a pointed tip and the Metzenbaum has a rounded tip. So depending on the density of the tissue, we can use either of the two. We have to take care that the scissors will not cut into the cyst because then the cyst contents will come out and it will be very difficult to identify the borders of the cyst. Another scenario after flap reflection is that the cortical bone is still intact. In that case, we have to create a bony window. For this, we can use number 6 or number 8 round burr. This is called as cortical ostectomy. The window should be large enough to allow total removal of the cyst. Sometimes when the bone overlying the cyst is very thin, as in case of a large cyst, we can remove the bone pieces with a curette or a periosteal elevator. Once we have access to the cyst, we are going to use a curette to separate the cyst from the bony cavity. We need to use the largest curette that will fit into the bony cavity. This will prevent tearing of the cyst wall. The edge of the curette is pushed between the capsule of the cyst and the bony cavity. You can see here that the convex surface of the curette is towards the cyst and the concave surface is towards the bony wall. The edge of the convex surface performs the stripping of the cyst. Again, I would like to highlight that we should avoid tearing the cyst because margins of the cyst are easier to define if the cystic wall is intact. Also, the cyst separates more readily from the bony cavity when the intracystic pressure is maintained. Once the cyst is out, we need to inspect the area to ensure that the cyst is completely removed. So for this, we should irrigate the cavity and then dry it with sterile gauze. If there is any residual tissue, it is removed with curettes. Then the bony edges of the defect are smoothed with a bone file before closure. If the cyst is surrounding tooth roots, it's possible that because of enucleation, the teeth will be devitalized. So endodontic treatment of the teeth may be necessary. This will help prevent odontogenic infection of the cystic cavity from the necrotic dental pulp. What happens after the cyst is removed? The bony cavity is filled with blood clot that will organize and remodel and result in bony repair. Radiographically, you can see the evidence of bone fill in about 6 to 12 months. According to studies, complete jaw ossification takes about 12 months after enucleation for defects up to 3 centimeters, and for larger defects, almost complete bone healing can be expected after 24 months. The main advantage of enucleation is that the entire cyst specimen can be sent for histopathologic examination, and since the cavity is not left open like we do in marsupialization, the patient doesn't have to care for a cavity with constant irrigations, so postoperative care is reduced. Disadvantages are adjacent vital structures could be damaged. Enucleation of a large cyst can weaken the mandible, so fracture of the jaw could occur. Devitalization of teeth could result, and if it's a dentigerous cyst, the unerupted tooth could be removed with the lesion.